Nurse Aid CNA Exam Practice Test Hardest 40 Questions Answers. Question 1. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap, below the bladder to prevent backflow/infection. Question 2. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard. Question 3. A resident wants to complain about care. You should tell them to be quiet. Inform the nurse or ombudsman. Ignore them. Tell them they are wrong. Residents have a right to voice grievances. Question 4. What is a living will? A bank account, legal document about end-of-life care, a birth certificate, a list of belongings. Advance directive for medical wishes. Question 5. Abduction means moving toward the midline, moving away from the midline, turning a joint, straightening a limb. Abduction is taking away from midline. Question 6. A resident is choking and cannot speak. What should you do? Wait for help. Perform abdominal thrusts. Offer water. Hit their back. Abdominal thrusts Heimlich for complete obstruction. Question 7. Postmortem care is for before surgery, after death, after birth, during sleep. Care given to a body after death. Question 8. When a resident is on NTO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPO means nothing by mouth. Question 9. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 10. Which position is best for a resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's upright aids lung expansion. Question 11. How should you identify a resident? Ask their roommate, check their room number, check their ID band, call them by name. ID band is the standard identifier. Question 12. How often should a resident be repositioned? Every 4 hours, once a shift, every 2 hours, once a day. Standard is every 2 hours to prevent pressure sores. Question 13. Which of these is a sign of skin breakdown? Redness that doesn't go away, tan skin, dry skin, freckles. Non-blanchable erythema is a stage 1 pressure injury sign. Question 14. When dressing a resident with weakness on one side, dress weak side first, dress strong side first, dress both at once. It doesn't matter. Dress weak DBW and dress strong. Question 15. Where is the radial pulse located? Neck, ankle, thumb side of wrist, inner elbow. Radial is at the wrist. Question 16. A resident is angry and shouting. You should shout back, leave the room, stay calm and listen, call security immediately. Therapeutic communication involves staying calm. Question 17. When feeding a resident, you should rush them, Offer small bites and wait. Use a straw for everything. Talk to other staff. Prevents choking and promotes dignity. Question 18. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 19. A resident refuses a bath. You should force them, respect their refusal and report it. Call their family, tell them they smell. Residents have the right to refuse treatment. Question 20. A resident falls. What is your first action? Help them up, call for a nurse, move them to bed, give them water. The nurse must assess for injury before moving the resident.